Good afternoon and good evening. First of all, I would like to thank His Excellency President Ramaphosa for joining us today for this important announcement. Your Excellency, welcome, and we look forward to your remarks in a few minutes. Globally, newly reported cases of COVID-19 have now declined for 8 weeks in a row, and deaths have declined for 7 weeks in a row. This is good news, but new infections and deaths remain high globally. Last week, more than 2.5 million cases and almost 64,000 deaths were reported. That is lower numbers of hospitalizations and deaths. Other countries in Africa, the Americas, and Asia are now facing steep epidemics. These cases and deaths are largely avoidable. There are several reasons for this increase, including the increased spread of variants of concern, more social mixing, ineffective use of public health and social measures, and vaccine inequity. The inequitable access to vaccines has demonstrated that in a crisis, low-income countries cannot rely on vaccine-producing countries to supply their needs. We haven't seen it before with HIV, when people in low and middle-income countries couldn't access life-saving antiretroviral treatment. We have seen it with diabetes, where insulin is priced high despite having been around for more than a century. The COVID-19 pandemic has shown that relying on a few companies to supply global public goods is limiting and dangerous. To boost manufacturing, WHO has continued to call for the sharing of know-how, technology, and licenses, and the waiving of intellectual property rights. Enhancing local production of health products has been an area of focus for WHO for several years, but the pandemic has brought it into even sharper focus. Just a few weeks ago, the World Health Assembly adopted a landmark resolution on strengthening local production of medicines and other health technologies to improve access. And today, I joined the World Local Production Forum, which aims to strengthen production capacity where it exists and to build it where it's lacking. In April, WHO issued a call for expressions of interest to establish technology transfer hubs for COVID-19 mRNA vaccines. Tech transfer hubs are training facilities where manufacturers from low and lower middle-income countries can receive training in how to produce certain vaccines and the relevant licenses to do so. mRNA technology has been in development for decades and is the basis for at least 2 safe and effective COVID-19 vaccines. It's potentially easier to scale than other vaccine technologies and could be faster and easier to adapt to variants of concern. Following our call for expressions of interest, we received more than 50 proposals, about half of which were from companies or institutions interested in receiving technology, and half were interested in providing the technology or acting as the training hub for or both. Today, I'm delighted to announce that WHO is in discussions with a consortium of companies and institutions to establish a technology transfer hub in South Africa. The consortium involves a company called African Biologics and Vaccines, which will act as the hub both by manufacturing mRNA vaccines itself and by providing training to a second manufacturer called BioVac. In time, Afrigen could provide training to other manufacturers in Africa and beyond. The Africa Centers for Disease Control and Prevention will provide guidance through the Partnership for African Vaccines Manufacturing. WHO is facilitating this effort by establishing the criteria for the technology transfer, assessing the applications, developing standards, and providing ongoing support and training. We are now in negotiations with several companies that have indicated interest in providing their mRNA technology to the hub. This selection will be based on how advanced the technology is in terms of clinical efficacy data and on the terms under which the company is willing to share its technology. In the coming weeks, we will continue to assess proposals for other tech transfer hubs for mRNA and other technology platforms. It's important to emphasize that this is an important step that will yield results in the medium term. In the short term, we need to do everything possible to increase the equitable production and distribution of vaccines through COVAX. To say more about the South African hub, it's my great honor to be joined by His Excellency President Cyril Ramaphosa of South Africa. President Ramaphosa, thank you so much for joining us today again, and you have the floor.